There are various male reproductive diseases, and today we are going to discuss 5 of them. The first one is erectile dysfunction. This is when a man cannot keep an erection firm enough for sex. Symptoms can include a reduced sexual desire and troubles getting and keeping an erection. This may cause men to stress, be insecure, and contribute to relationship problems. Problems getting or keeping an erection can also be a sign of an underlying health condition that needs treatment and a risk factor for heart disease. Depending on the cause and severity of each man's erectile dysfunction and any underlying health conditions they might have, various treatment options will be available. For example, oral medications are a successful erectile dysfunction treatment for many men. They include sildenafil, tadalafil, vardenafil, and avanafil. All 4 medications enhance the effects of nitric oxide, which is a natural chemical that produces in a man's body that relaxes muscles in the penis. This increases blood flow and allows men to get an erection in response to sexual stimulation. Another form of treatment is a penis pump, and it's a hollow tube with a hand-powered or battery-powered pump. This tube is placed over your penis, and then the pump is used to suck out the air inside the tube, which creates a vacuum that pulls blood into your penis. Once you get an erection, you slip a tension ring around the base of your penis to hold in the blood and keep it firm. But some men may experience some side effects when using this method. There's another treatment that allows men to get penile implants. It involves surgically placing devices into both sides of the penis. These implants consist of either inflatable or bendable rods. Inflatable devices allow you to control when and how long you have an erection. The bendable rods keep your penis firm but bendable. Penile prostate implants are usually not recommended until other methods have been tried first. It's a small walnut-shaped gland in men that produces the last seminal fluid that nourishes and transports exercise, sperm. Especially moderate aerobic activity, and usually which can improve and is initially confined to the prostate gland where it may not cause serious harm. Although some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. Prostate cancer may cause no signs or symptoms in its early stages, but prostate cancer that's more advanced may cause signs and symptoms such as trouble urinating, decreased force in the stream of urine, blood and semen, bone pain, and erectile dysfunction. The treatments for prostate cancer depend on several factors, such as how fast your cancer is growing, how much it has spread, and your overall health, as well as the potential benefits or side effects of the treatment. Surgery for prostate cancer involves removing the prostate gland, some surrounding tissue, and a few lymph nodes. Radical prostatectomy can be performed in several ways, by using a robot to assist with surgery or making an incision in your abdomen. Radiation therapy uses high-powered energy to kill cancer cells. Prostate cancer radiation therapy can be delivered in 2 ways: radiation that comes from outside of your body, or radiation placed inside of your body. Radiation that's outside is called external beam radiation, and radiation that's placed inside is called brachytherapy. Some men may experience side effects of radiation therapy that can include painful, frequent, or urgent urination, as well as rectal symptoms such as loose stools or pain when passing stools. And also, erectile dysfunction can also occur. Hormone therapy is treatment to stop your body from producing the male hormone testosterone. Prostate cancer relies on testosterone to help them grow. Cutting off the supply of testosterone may cause cancer cells to die or to grow more slowly. Hormone therapy options include medications that stop your body from producing testosterone, medications that block testosterone from reaching cancer cells, or surgery to remove the testicles. Hormone therapy is used in men with advanced prostate cancer to shrink the cancer and slow the growth of tumors. Another form of treatment is chemotherapy, and chemotherapy uses drugs to kill rapidly growing cells, including cancer cells. Chemotherapy can be administered through a vein in your arm, in pill form, or both. Chemotherapy may be a treatment option for men with prostate cancer that has spread to remote body locations and can be an option for cancers that don't respond to hormone therapy. Testicular cancer occurs in the testicles located inside the scrotum, a loose bag of skin underneath the penis. The testicles produce male sex hormones and sperm for reproduction. Testicular cancer is rare, but it is the most common cancer in American males between the ages of 15 and 35. Men who have this type of cancer may experience a lump or enlargement in either testicle, a feeling of heaviness in the scrotum, a dull ache in the abdomen or groin, a sudden collection of fluid in the scrotum, pain or discomfort in a testicle or the scrotum, enlargement or tenderness of the breasts, or back pain. Testicular cancer is highly treatable even when cancer has spread beyond the testicle. Depending on the type and stage of the testicular cancer, you may receive one of several treatments or combinations. Operations used to treat testicular cancer include surgery to remove your testicle, and is the primary treatment for nearly all stages and types of testicular cancer, or surgery to move nearby lymph nodes, and it's performed through an incision in your abdomen. Another form of treatment is radiation therapy, and radiation therapy uses high-powered energy beams to kill cancer cells, and it may be recommended after surgery to remove your testicle. But some men also may experience side effects that may include nausea and fatigue, as well as skin redness and irritation in your abdominal and groin areas. Radiation therapy is also likely to temporarily reduce sperm counts and may impact fertility in some men. Chemotherapy treatment uses drugs to kill cancer. Chemotherapy drugs travel through your body to kill cancer cells that may have migrated from the original tumor. Chemotherapy may also be a man's only treatment, or it may be recommended before or after lymph node removal surgery. Chemotherapy may also lead to infertility in some men, which can be permanent in some cases. Epididymis is an inflammation of the coiled tube at the back of the testicle that stores and carries sperm. Males of any age can get epididymis. Epididymis is most often caused by a bacterial infection, including sexually transmitted infections, such as gonorrhea or chlamydia. Sometimes the testicle also becomes inflamed. Signs and symptoms of epididymis might include a swollen, red or warm scrotum, testicle pain and tenderness, usually on one side that usually comes on gradually, painful urination or an urgent or frequent need to urinate, discharge from the penis, pain or discomfort in the lower abdomen, or blood in the semen. Antibiotics are needed to treat bacterial epididymis and epididymoorchitis. Men should start to feel better within 48 to 70 hours of starting an antibiotic. Resting, supporting the scrotum with an athletic strap, applying ice packs, and taking pain medication can help relieve discomfort. If an abscess has formed, surgery might be necessary to drain it. Sometimes all or part of the epididymis needs to be removed surgically. Surgery may also be considered if epididymis is due to underlying physical abnormalities. Epididymis usually causes considerable pain, so to ease the comfort, men might need to rest in bed, lie down so that their scrotum is elevated, apply cold packs to their scrotum as tolerated, Wear an athletic supporter, avoid lifting heavy objects, and avoid sexual intercourse until the infection has cleared. Up to 15% of couples are infertile. This means they aren't able to conceive a child even though they had frequent unprotected sexual intercourse for a year or longer. The main sign of male infertility is the inability to conceive a child. There may be no obvious signs or symptoms, but in some cases, an underlying problem such as an inherited disorder, a hormonal imbalance, dilated veins around the testicle, or a condition that blocks the passage of sperm causes signs and symptoms. Although most men with male infertility do not notice symptoms other than the inability to conceive a child, signs and symptoms associated with male infertility include problems with sexual function, pain, swelling, or a lump in the testicle area, recurrent respiratory infections, inability to smell, abnormal breast growth, decreased facial or body hair, or other signs of chromosomal or hormonal abnormality, and a lower than normal sperm count. Doctors might recommend treatments or procedures that will result in conception. Treatments for male infertility include surgery. For example, a varicocele can often be surgically corrected or an obstructed vas deferens repaired. Treating infections, antibiotic treatment might cure an infection of the reproductive tract but doesn't always restore fertility. Treatments for sexual intercourse problems, medication, or counseling can help improve fertility in conditions such as erectile dysfunction or premature ejaculation. Hormone treatments and medications. The doctor might recommend hormone replacement or medication in cases where infertility is caused by high or low levels of certain hormones or problems with the way the body uses hormones. And assisted reproductive technology, also known as ART, and involves obtaining sperm through normal ejaculations, surgical extraction, or foreign donor individuals, depending on your specific case and wishes. The sperm are then inserted into the female genital tract or used to perform in vitro fertilization or sperm injection. This is my works cited, and I basically use Mayo Clinic for all the information that I used in these slides, and I hope you enjoyed my presentation. Thanks.